Until a few weeks ago, most of us probably thought we knew what saving a life with CPR looked like. It's on TV all the time, right? But then Damar Hamlin's heart stopped on the football field, and some of the most fearsome grown men in the world started weeping at the sight. The EMTs who saved Hamlin have rightly been celebrated, but stop for a moment and consider how often they live through trauma like that. Tonight, let's salute the heroes who are there to help them.
At least on a weekly basis, there's weekly, if not daily basis, I mean, in the EMS field that could make a grown man cry, football player or not.
Emergency medical techs don't usually do it in front of 65,000 people, but they perform heroic actions, often using methods that are downright frightening.
And this isn't an easy job. A lot of people can't do this job. They don't want to do this job.
Making the ones that do want the job precious.
There are people who want to help folks, and this is a great place for them to get in and help folks. And when we get them in, we want to keep them.
That's why the trade organization for the state's ambulance companies, your MEMS, your LifeNets, Pafford, are teaming up with the rank-and-file EMTs to help them after the call.
That's just our mindset. We want to go help other people, so we're not always real good about slowing down and realizing, hey, we need to receive the help that we're used to giving.
Amanda Newton is president of the Arkansas Ambulance Association. Her whole career has been riding in emergency vehicles and now running an ambulance company. And together with Casey Jones, they lead what are called critical incident stress management teams.
People really think they're heroes and think that they're made of iron, but they're not. We're life and flesh and blood, and you know, we weren't designed to see the things we see.
Supervisors are now on alert, and crews are now being taught that when they do see these awful things, mass casualty events, things involving kids, things involving colleagues, don't hesitate.
We try to make initial contact with the responders on scene within the first 24 hours just to kind of touch base, make sure they're okay. Within the next 24 to 72 hours, we try to have a formal debriefing meeting where we bring them in and discuss the incident.
Maumelle firefighter and EMT Patrick McIntyre knows airing it out quickly is important.
Talking to others, a lot of times, I mean, it's peer-to-peer, you can talk it out, and it's not good to bottle it up.
These professionals have learned stress management lengthens, even saves careers, at a time when we need career lifesavers back out there saving lives.
We tell them you need to guard your calling by accepting the resources that are there to help you to guard that, because you want to be able to take care of yourself so you can take care of others.
It's all about coping skills and understanding that, you know, there are things and there's people out here to help them, to talk to them, to assist them as they go through their life's trauma.
If you know groups like the Critical Incident Stress Management Teams that deserve a salute, send a note my way on social media. You can find me at Rolly Hoyt on Twitter or Rolly Hoyt THV11. We'll be right back.
Amanda, with this $1,000 check, Rainwater, Holt Sexton salutes the emergency medical service providers in Arkansas and give you our thanks.
Thank you. We will definitely use this to help promote mental health awareness across EMS professionals. We appreciate your contribution.